Good afternoon, ladies and gentlemen. We'd like to welcome you to Tech Today, to the 30th webinar of the Healthy Flint Research Coordinating Center. I'm your host today, Yvonne Lewis, and excited to have had the opportunity for the last 30 weeks, along with the partners of the HFRCC, to bring you this webinar, the Flint Community Webinar on coronavirus. It's amazing that we have ended here, or not ended, began 30 weeks ago to have this conversation. I want to particularly take a few moments today to especially thank the partners of the Healthy Flint Research Coordinating Center having to work together for this 30 weeks to bring this webinar to you, particularly giving appreciation. And I've told you it's a partnership, an institutional partnership with community and academic partners, and haven't really given a lot of attention to the partners specifically by name because we've been so busy doing the work and wanted to hear from you. But I do want to take this privilege this afternoon to say thank you to the community core of the Healthy Research Coordinating Center that is comprised of the community leaders on this team. The co-director, along with myself, is Ms. Tanya French Turner. Our program coordinator is Ken Cabine, and of course, Ms. Ella Green Moulton, who serves as a CBOP SERV coordinator that makes up the community core. Along with us is the University of Michigan Flint, is Ken Sylvester, Dr. Ken Sylvester, as well as Dr. Carmen Stokes, excuse me. Then with Michigan State University, Dr. Deborah for Holden, along with Dr. Rick Sadler. And then at the University of Michigan in Ann Arbor, it is Tricia Pachowski, along with Dr. Susan Wolford. And we together worked with a number of other partners behind the scenes to make sure every week we can bring this information to you. It would not be what it is, however, if you weren't here sharing with us. So we do want to appreciate every one of our partners who have been on the calls to help us to respond to questions that you have raised. So we want to encourage you today, as we have each week, continue to raise those questions for us. As a result of those questions, we have some exciting information that we're going to share with you. Today, I just want to give you a little glimpse of who you're going to hear from today. Along with the City of Flint and the Genesee County Health Department, we have today with us a representative from the City Clerk's office that you will hear from directly as a result of some of the questions that have been raised. We continue to have representation as our panel from the Genesee Health Plan, from the Flint Community Schools, along with Michigan Department of Health and Human Services, as well as Genesee Health System. So these partners are coming every week to make sure that they can answer questions to you. So please put your questions in the queue. If you're listening to us and you've joined us by YouTube, Facebook Live, or all the social media platforms that are available, you may be on our YouTube page, and you maybe even have called in by phone, and you have opportunity to include your questions and comments as well. So we'd like you to know that you can call us at call us at 810-835-2130. That's 810-835-2130, and have your questions included. Or you can go to our website at info@hfrcc.org. That's info@hfrcc.org, and then get your questions in there. But we certainly appreciate hearing from you every week. We want to acknowledge that this is a difficult time for us all, and every day we're learning about more persons who are either testing positive or who are passing away from COVID. So we always want to take a moment to make sure that we acknowledge and be appreciative of our ability to be here, but also be mindful that others are not. So it's just this quick moment of remembrance. Thank you. And again, as we mentioned, our intention here is to bring information to you about this global pandemic with local insights about resources and services. So with that, I want to begin our session today again with the City of Flint. talking with the representatives from the city of Flint. Dr. Lawrence Reynolds has always been a key individual for us to bring information from the city. But I know that today we're going to hear from Miss Billy Mitchell. Billy Mitchell is, if we can go to that next slide, please. Billy Mitchell is in the City Hall as the manager of public health. And so, Billy, would you please share with us updates from the city, and then invite our city clerk, Inez Brown, to share as well.
Yes. So normally I give updates about voting, but I won't do that today. I'll just give you our general updates. We are still doing mask and water filter and water test kit distribution here at the City of Flint. Those are available 8 a.m. until 4 p.m. Here at the front counter, the information counter. As soon as you walk into City Hall is located at 1101 South Saginaw Street in Flint, Michigan, downtown, right across from the county building or the county jail. You can also call me at 810-237-2044 or email me at bmitchell@cityofflint.com if you want to opt in to get your lines replaced. I will either send you a form or I will collect your form at the door, and I will take your form down to road to make sure that you are on the list to have your pipes inspected to see if they are lead or galvanized. Other than that, there's nothing more for me to report. Customer service is open to take your cash payments for your water bills and your property taxes from 9 a.m. to 1 p.m. here at City Hall, Monday through Friday. So I'll go ahead and turn it over to the city's clerk, Ms. Inez Brown. I know she has someone from her office also accompanying her to give you more information about voting. So Ms. Inez, whenever you are ready, you can go ahead and jump on. Just go ahead and unmute.
We can go to the next slide, please. And Inez is our city clerk. She's been working in that city clerk's office for a number of years now. And while she's getting her mic unmuted, we want to appreciate her for taking the time to come and be with us today. As Inez, as you know, there are many questions surrounding this voting process, the early balloting, and we hear a lot on the news about the challenges for voting in this season. So Inez, if you'll need to unmute your mic, unless I can get some staff in the background to help unmute her mic for it's very important that our listeners, hi, there you go, Inez.
There we go.
There you go.
Okay. Well, listen, I would really like to take this opportunity to thank you all for inviting me to your meeting this morning. And I brought with me our election supervisor, Gloria Boone, who's also been with us for a number of years, just to kind of fill the community in on the voting process, as well as some of the expectations for the upcoming election. In that regard, we have received and processed close to 17,000 absentee ballots as of last night. And we are working weekends, Sundays, holidays, the whole 9 yards in order to be sure that the citizens of the city of Flint are properly served as it relates to the voting process. Therefore, commencing next weekend, October the 17th, all the way up through the election, we will be open Saturdays and Sundays from 9 a.m. until 5 p.m. to allow individuals from our community the opportunity to come in and vote over the counter. So City Hall will be open for that purpose. Daily, City Hall is open from 8 a.m. to 5 p.m., Monday through Friday, for that purpose as well. And we would like to encourage everybody just to come in and exercise their right to vote. In that regard also, I think it's important to indicate that we do have 61 precincts located throughout the city of Flint. And in that regard, in that 61 precincts, it represents about 23 buildings from the north to the south to the east to the west of the city. We've tried to make everything available to our community so that people will not have that far to go in order to cast their votes. And I would say that for election day, for individuals who plan to go to the polls to vote, they should feel free to go. Our election inspectors will be going through some extensive training and retraining, as well as new worker training, to ensure that individuals who come to vote on election day are properly serviced. In that regard, because of the pandemic situation, naturally, we will observe the 6 feet rule in terms of people staying that far away from each other. In addition to that, our staff people, our poll workers, will be properly masked. They will have on their rubber gloves, and we will also have in each precinct the disinfectant spray as well as disinfectant lotion and so forth. So I just want people to not feel that they cannot exercise their right to vote at this point in time. And whatever questions individuals may have as it relates to the process, they can certainly feel free to call our office Monday through Friday or Monday through Sunday at this point at 766-7414 to express whatever concern they may have. I should also indicate that we have some drop boxes. We have 2 drop boxes here at City Hall already, whereby if individuals already have their ballots and they don't want to put them in the mail through the US postal system, they can use the drop box in front of City Hall, which is locked and secured, or the drop box on the side of City Hall, which is near the Flint Police Department and the fire station. And I should also indicate that we have installed 4 other drop box locations at 4 locations throughout this, 4 fire stations throughout the city. I will be doing a press announcement the first part of next week to indicate to the community where those fire stations are, but we're waiting now for some of the security measures to be installed before we make the official announcement. Coupled with that, I should indicate that we will have 4 satellite offices, whereby if individuals want to go to 4 satellite offices that we have staffed to drop off their ballots, they can do so. Those 4 satellite offices would be Word of Life Ministries on the south end of Flint, Burston Fieldhouse on the north end, Mintz Manor on the east side, and West Court Street Church. We're also in the process of talking to the not the owners, but the managers of Hasselbring, as well as Brennan Center, to get those 2 locations added as a part of our satellite as well. Now, this is to be sure that all of our people have a right to go out and exercise their right. I'm open to any questions or concerns that you all might have. Gloria is also here to answer all might have.
Thank you, Inez. I just want to ask you if you could just, because I want everybody to see you, and I'm only seeing a partial. So if you could center yourself in the frame there. Quick question for you, because I think it's so important that everybody sees who our wonderful city clerk is. Thank you, in that office. And there is a quick question, and that is, if a person has not already ordered their absentee ballot, can they pick one up in person? Can you talk about what that process is when they come in to
Yes.
vote absentee?
Sure, I'm going to let Gloria explain that, and maybe you'll be able to see her. She's far prettier than I am. So.
I can't see myself, so
can't
I don't
see
know if you can
yourself?
see me.
Okay.
Well, first of all, those, I just want to make a pinpoint. We've been running into numerous ballots that we've issued due to our dual application from August. So the community may not be aware if they filled one out for August that we utilized and used that as a dual for the November. They're coming in the office. You need to bring a photo ID. If you don't have an actual photo ID or the necessary documents to produce that, you can sign an affidavit and you'll still be able to obtain your absentee ballot. What we're running into, like I had indicated, is we've issued ballots due to the dual app, and those that may have not received it in the mail, they're coming in the office to, in return, pick one up over the counter. In that return, they'll have to sign an affidavit to spoil the current ballot issued to them, and then they'll be able to get one in person here at the office. If they do have a ballot that's already been issued and at the house, they can surrender their ballot just as at the polling sites on election day here in the office, and then we'll give them another ballot to issue. One other thing that we've been running into is some of our residents that live outside of the city of Flint are also coming into our office to vote. So we are only for city of Flint residents. Those that have a Flint mailing, of course, it says Flint mailing, but you may reside in an outer township or city outside of Genesee County. So if that's the case, then you maybe not know where you're registered to vote or your precinct. You can give us a call beforehand. We can confirm where you're registered or where your driver's license has you residing, registering to vote. Some may not be aware that if they change their address at the post office, that is not your driver's license registered address. So we're just running into, some of our residents are not aware of where they're registered, or we're unable to go to the Secretary of State's office, which of course we know that's due to the COVID and they're not open for all business for the public. So that's one thing about the address is what we're running into as far as you're not able to go and change your address. So with the voter registration, you're able to register to vote online, through the mail, or in person up until the 19th of October. But thereafter, you have to be in person all the way up until election day. So for those that are unable to go to the Secretary of State's office, your appointment may not be until after the election. Feel free to bring in your photo ID and some sort of documentation, which are certain credentials that you're able to make your change of your address in person. And then we would, in return, you can obtain your absentee ballot on that same day, or you're allowed to go to your precinct location on election day. But while you're here, most of them are just going ahead and obtaining their ballot, casting it here, and returning them in our drop box. So those are the few main things that we've been running into. Is you have to be a city of Flint resident. Although you have a Flint mailing, that's just for mailing purposes. Another thing we've been running into is if you are having your mail forwarded elsewhere and you've sent a forwarding with the post office, our absentee ballots or anything that we mail out from the city clerk's office is not forwardable. So your ballot will be returned to our office after it's unable to be sent to your mailing residence. So a lot of our residents are not aware of that. They feel that they let the post office, be aware of where they're staying or residing, but their ballot is being returned back to us. So it's important that if you are not at your resident home, to please put that information on your absentee ballot application. That way we can forward your ballot the first time at the correct address where you're at. One other thing is if you spoil your ballot, it's unfortunately, I know we went through the mail process to obtain your ballot, but if you do in fact spoil your ballot, you have to put in writing to request a new one. So we do have a pre-printed affidavit that we have here in the office, but you are able just to draft your own. It would just simply be your name, your address, your birth year, not the date and month, and just indicate that I received an absentee ballot, but I've spoiled it. I need a new one issued, and actually sign your name. And then we can currently spoil the ballot and then reissue you a new one. Or you can come in person with or without the ballot, sign the affidavit here, and then we'll obtain a new ballot for you. So some of them are just calling and just saying we need a new one.
Thank you, Gloria. I was just going to say, between you and Inez, we need a whole webinar on this. That's a lot of information.
Well,
a lot of wonderful
if all else
information that we
fails,
need to know.
you can contact our office and we can, explain or help you with any needs that you need.
Right. So we want to give that number out again for the city clerk's office.
810-766-7414. And that is directly into our office, no recording.
Thank you. That's good to know, because these are critical questions. Now, Inez, I have one other question, and I'm not sure which one of you would be able to respond to this, but there are people who are interested in working to be authorized ballot handlers. Can you give us some sense of what that process is real quickly, and what persons need to do if they want to be an authorized ballot handler?
I'm not familiar with that particular category that you're referring to. An authorized ballot handler. Do you mean an election inspector?
An election inspector, someone who would actually work the polls.
Okay, someone who would actually work the polls is called an election inspector. And
Okay.
first of all, that person must have a high school degree, diploma or better. And we give them a test, and then we also take them through training. We don't allow anybody to go into the field to work without having gone through some training. At this point in time, we have about 350, close to 400 election inspectors. And we do plan to take those election inspectors through retraining before the election, in addition to probably close to 200 new people who have filed to become new election workers. We have to take them through new election worker training prior to the election. In other words, no one will go into the field without some kind of training. And we then place them, of course, at a precinct where there are experienced and workers that they can certainly learn a lot from. Okay.
Okay. Well, thank you so much, Inez. This looks like that we may need to have you before, because we've got few more weeks, just a very few more weeks before November 3rd, our election day. And we certainly appreciate you coming on today. And if there are additional questions, we're sure that individuals will call you at the number that you shared, 810-766-7414, to get that information. And certainly, please make sure whatever you do, let's vote. We've indicated to you this is a very important election. We're not only voting for our local, which I mean Genesee County and the city of Flint officials. We're also voting for state, we're voting for judges, and we're voting for our national representatives who are there to represent us and make sure that our needs are cared for. So let's be sure that we take advantage of these opportunities that so many have given so much for us to have. Thank you, Inez and Gloria.
Can I indicate one last thing?
Yes.
The importance of voting is really, really, really very key. And I would indicate to the voters in the city of Flint, whatever our office can do to help facilitate. We're not trying to influence how anybody votes. We just want people to be sure to exercise their constitutional right and get out and cast their vote. And whatever questions they may have, feel free to give us a call, because we're willing to help in whatever way we can in that regard. And thank you so much for having us.
Thank you so much. I appreciate us being able to understand the barriers that have been addressed in order to make sure we have these opportunities. So we want to move we're next now to the Genesee County Health Department. Thank you, Billy, for helping us with this first section. We move to the Genesee County Health Department. Just quickly, let's continue to complete the census. And that's another important activity for us. But in the next few days, there are a lot of conversations about this. If you have not completed the census, we just want to make sure those of us that are advocates to go out and just ask that question to those that you participate and engage with. Thank you so much. Let's talk now to Kim Van Slyke at the Genesee County Health Department. Kim, good morning.
Hello, Yvonne. How are you today?
I'm well. How are you today?
I'm good, thank you.
I know that you have been extremely busy, and your forte for us and key subject has been contact tracing.
Yes,
And today we've asked you to add a little bit to that and talk about the importance of contact investigation as well. And so let's talk about what we need to do to break the chain of transmission of the coronavirus.
So as with everything public health, it's all about communication and education. And we thank you for all of these webinars and getting this information out there. As I've mentioned before in my presentation, it really starts with the case investigation and the identification of the person that's positive COVID or probable COVID, which means that they're symptomatic and they have had direct contact with somebody who has tested positive. So we identify those people, their names are put into the state database, and we start a case on them. And then we call them and we do an interview with them, and that's part of the investigation, is asking what their symptoms are and where they might have been for the last 14 days that they possibly could have contracted this. This has become very important as we have started to open up back in our state with our kids back in school and all of the activities opening back up. People are out and about and have much more contact to other individuals. So knowing where they've been, where they possibly could have been exposed to a COVID positive person, and then asking where they have been for the past 2 days, so that, or when their symptoms started or when they tested positive, and we look at that day and the 2 days prior to that, because that's when we know that they become contagious and are infectious to others. So we look closely at those 2 days to identify people who qualify as close contacts. Again, within that 6 feet, for a greater than 15 minutes accumulated time. So over the course of a day, if you've been with somebody for 5 minutes, and then 5 minutes again at lunch, and then 5 minutes again in the afternoon, and 5 minutes again at the end of the day, that's 20 minutes. That's greater than 15 minutes. So you would be considered a close contact. Identifying those close contacts, getting them into that case investigation chart, their name and their contact number, so that at this point, the state can pull those names out and can start that contact tracing process. So the case investigation and the contact tracing, this message that we have going on about answer the call, answer your phone, talk to the people from the health department, talk to the people from the state. That message is just as important to the people who have tested positive, who are being investigated, as it is to the contact tracers. Being able to give us that information, as we've talked about before, getting the contacts notified, helping them understand why we're quarantining, what the quarantine time is, what that involves, assessing whether or not they have resources during that time of quarantine. Do they have somebody that can drop groceries off for them? Is this creating a degree of hardship for them? Can we connect them with any resources to help with those hardships? All of those things are addressed during the investigation for a positive person, as well as during the phone call for contact tracing. But giving them that knowledge and giving them the power to make the decision to keep themselves safe and to keep others around them safe is really where this breaking the chain of transmission comes into place. Giving them that knowledge, giving them the empowerment to quarantine themselves and knowing why they're quarantining themselves creates a barrier around them, so that they, if they were to become contagious from the exposure that they had to that positive case, then by quarantining themselves, they're preventing that from being passed on to a whole nother group of people. So that's where this term breaking the chain of transmission comes into. If you wait until that close contact starts to become symptomatic and then tell them to isolate themselves, they've already passed it on. We haven't broken the chain of transmission because we didn't isolate them before they became infectious, before they became contagious. So that is the end goal of our case investigation and contact tracing, is the identification of those who've been exposed but are not contagious yet, so that we can quarantine them and protect their family and their friends from being the next exposure.
Thank you so much, Kim. I know this is a lot of information again for us, and it's hard to make these distinctions. And so we want to really emphasize to all of us that it is confidential. You do have to tell somebody something, but the fact that you tell them is kept in a confidential manner. And I think that's important. So if you are exposed to someone, it's important that you share this information when that call is made.
It is, and you are correct, it is confidential. It goes into the database, but that information is only used for COVID information. It's only used related to the person that you were in contact with, or others that you might be in contact to. That's all the information is used for. We will ask you to verify your name and your date of birth normally before we call. And then there is some reassuring information that we're able to give you. If you were a positive, we should be able to tell you where you had your test done. So then that is kind of a verification of, oh, yeah, okay, this is a real call. I can talk to this person. Again, looking at your caller ID is not always going to be the best answer, because we still have a lot of people calling from home. And unfortunately, the county doesn't have the resources and the access to be able to give everybody cell phones that say caller ID Genesee County. So just asking questions, asking them to verify. All of the people that are working with us have been trained in ways to reassure the public and give them some piece of information that verifies that we really are who we are.
Thank you, Kim. And one other thing that you mentioned to us in the previous conversations is, because it's confidential, you do need to share, but none of the persons that are calling you will ask you for any financial information or your social security number or anything like that. It should be specific to this situation.
It should be specific to COVID, specific to your health history, because those underlying diseases that you have in the past could potentially play into COVID. So we will ask about health history. We do not ask any financial information or private security information like your social security. If somebody is asking you about that, hang up the phone.
Thank you. Thank you so much, Kim. Now, this also leads us to the other part of the conversation is, how do we know if we're positive or not, and what happens with that information? So Suzanne Cooper, who is also at the health department, is going to share with us now. She gives us updates every week of what's happening countywide, but will also give us updates on the testing sites. Suzanne.
So as of yesterday, again, remember, we post to our website every day COVID-19 data information. We had 4,318 positive COVID-19 test results with 282 deaths. And again, this is not reflective of all the cases of COVID-19 that have likely been in our community, because we had limited testing at the beginning of the pandemic. Our positivity rate is 4.9. So we've talked about what the positivity rate means before. And again, remember that the World Health Organization has recommended that positivity rate over 5 is an indication to start pulling back a little bit. And again, we want to make sure that we remind everyone in our community that it is critically important that you practice all of those preventive measures that we continue to talk about. Wearing a face mask, appropriately social distancing, making sure you're washing your hands frequently, giving those surfaces that you touch frequently a good thorough cleaning, making sure that you use hand sanitizers if you can't wash your hands. All of those things that we continue to talk about are critically important. Also recognize that there are those individuals who may not demonstrate symptoms of COVID-19, but could potentially still test positive. So that is the reason why we want to encourage everyone to take advantage of the 3 local community testing sites here in Genesee County, and remind everyone that they are using saliva tests. So it is not the nasal pharyngeal swab, so you don't have to be concerned about that. But we do want to remind you, because it is a saliva test, you don't want to eat, drink, chew gum, or use tobacco products for 30 minutes prior to your visit. While these sites do encourage an appointment, they will see anyone who comes for a visit. That includes adults and children. Again, they are doing testing for both adults and children. And the 3 sites are Word of Life, Bethel United Methodist Church, and Macedonia Baptist Church. So remember, when you've had your test, you will get a call with your test results. These 3 locations are working really hard to get those test results back to you within 72 hours. And again, once you've tested positive, you will get a call from the health department. We encourage everyone to take that call and share the information that's asked for, so that you can help protect others from COVID-19, and again, interrupt that spread of the COVID virus. This is also the appropriate time of year for everyone to get a flu shot. So we remind everyone about taking care of their own health, both physical and mental health, and why that is so important. That includes getting all of your preventive screenings, including immunizations. And again, this is the appropriate time of year to get a flu shot. It is because we are having 2 respiratory illnesses at the same time this fall. We want you to protect your immune system by getting that flu vaccine, but it'll also help keep those people with flu out of the emergency room so that they're available to help with COVID-19 patients. So again, if you haven't had your flu shot, most of the local pharmacies have flu vaccine available. You can call your local physician's office, but we encourage you to get one. It's a really good time to remind everyone to eat well, exercise, practice stress reduction, and take care of both your physical and your mental health so that you stay well during this winter season.
Thank you, Suzanne. Now, you mentioned again asking us to answer that call. And one of the questions is, how do we know it's the health department? So is there a specific introductory statement by the contact tracer that we can expect that would give us a key that this is the appropriate call?
So I'll let Kim answer that one.
So again, with the state contact tracing, which is where most of the contact tracing is coming at this point, we have been told that for sure on a landline, it will read My COVID Help. And then if you have caller ID on your cell phone, it is also now supposed to read My COVID Help. If you do not have caller ID on your cell phone, which is confusing sometimes, because if you have a contact in your phone and it's saved in your phone and someone calls you, it's going to show up whether you are paying for caller ID on your cell service or not. But if you have full service caller ID, it will still show up the My COVID Help. If you do not have caller ID on your cell phone, then it will be a 1-866 number. And then they call and they inform you that they are calling on behalf of Michigan Department of Health and Human Services and Genesee County Health Department, that you have been named as a close contact for COVID-19. They also have texting, so they try to call some of the, we've really listened to a lot of the feedback that we're getting, and so a lot of the state callers will text first and introduce themselves and say, hi, I'm so-and-so calling from Michigan Department of Health and Human Services about a COVID-19 contact. I will be calling your phone in a little while. And so they prep them, and then they can follow up with, if they didn't answer the call, they can follow up with a text message as well. If you return the call now, it does go to a message, and you are given the option to speak to the supervisor or a person who's designated to take calls at the state for the day, and they can go ahead and do your contact tracing report right there while you're on the phone. So those are some improvements that have been made since the last time I was here.
Thank you, Kim and Suzanne. Appreciate all the information that we received from the health department. And let's just remember, this is important. Protecting yourself also protects others in the community. This communication is critical. Now, as we talk about communication, we had a very unfortunate incident that happened in our state yesterday. So we want to keep our governor in our thoughts and prayers. And every week for the last few weeks, she has been represented by Gary Jones. Gary Jones is from the city of Flint, and he is here with us today. And so we're going to ask Gary to share. And while he is sharing, I want to continue to ask you, please keep these questions coming in the queue. We have quite a few of them in there now, and our panelists are available to answer these questions for you. So Gary, I know you're out and about making sure you can keep up with things. Can you give us an update today?
Yeah, thank you, Yvonne. And first, I just wanted to say, so yesterday the FBI did thwart an attempt. There was actually a couple of groups that were involved. one in particular that was local, and actually is fairly well known in the state of Michigan. And there was another coordinated effort with some individual affiliated with some groups out where. So that's how you get the FBI's involvement, you know, with this attempt. But I did just want to her. She is going to continue to do the work on behalf of the people in the state of Michigan, continue to fight for what we believe in. She did a press stand up yesterday addressing the situation. But immediately after she addressed it, you know, she got back to talking about what we need to do to stop this virus, and reiterated that COVID-19 is the true enemy. You know, we can have political disagreements all day. You know, of course, you know, she encourages, you know, people, you know, to voice their opinions, you know, in regards to governance of First Amendment. But obviously, you know, it was a very concerning situation. Several people, you know, reached out to myself, reached out to the governor, and she does see those outpourings, those social media posts, you know, those text messages, you know, all of that does get communicated back up to her. And so we just appreciate all of the thoughts, all of the prayers, all of the concerns, and everything. But she is doing quite well. She has a really, really steel resolve, and we're going to continue to fight.
Thank you so much, Gary. I know you're out and about, and we appreciate you. I just want to emphasize that Gary can be reached at 517-282-3198. And we do have, let me say that again and get it right, 517-282-3193 is his number. And you can also send him an email. He'll be happy to give you any updates from the city. As we move to our next segment, which I'm sure is critically of great interest to everybody who heard about this last week, and I'm happy to have again with us today Isaiah Oliver, who is the CEO at the Community Foundation of Greater Flint, to come and share with us about this funding opportunity that now you only have a few hours if you're going to apply. Good afternoon, Isaiah.
Yvonne, thank you so much for having us again. We are excited again to have this opportunity to share or to ensure resources get to the community, this community that needs it greatly and will benefit greatly by having it available. I'm going to apologize up front. Moses Bingham is on the line as well, and he's going to give some additional details related to the funding. But I just want to apologize up front. We are trying our best to get state dollars or federal dollars to the local community, to the grassroots groups that are doing the work on the ground. And as a result, we're learning a lot about federal processes, federal grants processes. And so Moses will talk a little bit about Dunn's numbers and Sam's clearance and some other things that we have to do to ensure that we're spending these dollars appropriately. These are not our typical community foundations or private philanthropic resources. They are federal dollars. And so some of the rules are a bit different. And so we're learning it as we go, but we have a good number of proposals in right now, some amazing projects that we're already in, and some new transformative projects that are moving forward. And so for that, we thank our community and we look forward to the continued work. At this time, I'm going to pass it over to Moses, who will talk a bit more about this set of proposals that we have. Again, $1 million set aside for urgent relief, $925,000 for innovative projects, and about $250,000 for supports for Black-owned businesses. Moses.
Hello, and good afternoon, everyone, to Miss Yvonne, and all the curators and all the people who are here on this call trying to make a difference in our community. Bring you greetings from the Community Foundation of Greater Flint. I am happy and excited to serve as Director of Special Projects and Initiatives. And as Isaiah has mentioned before, and as we were on this call on last week, an exciting new opportunities for the Genesee County Flint community. And we want to make sure everyone knows about this. Everyone has the opportunity to put their ideas and projects forward so that we could do the best that we can as a as a community to attack this pandemic period that we're in. And so I just wanted to share and reiterate the purpose of the Rapid Response Initiative grant that we have before us. And obviously, it came to us very quickly, and the turnaround time to get things out. Background info, there were CARES Act dollars that were flooded throughout the community. And there were proposals and opportunities as early as March of this year. And so there's another opportunity here, and we rolled out this RFP last week, and the deadline is today at 5 o'clock. So we're funding shovel-ready projects geared towards 6 categories in which I'll talk to you about earlier. And of course, last week was the day that we put out the RFP on October 2nd. Today is the last day at 5 p.m. To email your submissions. And once again, we cannot do anything with the late applications. And so we want to ensure the review committee has their time to look at the proposals and get back to the awardees exponentially. And so just kind of 4 points just to look at and remind us about. We will be announcing the funding on October 15th. Once again, a very quick turnaround time to get that out. The implementation time period spans from October 1 to December 30th. That means all dollars have to be spent, all activities have to be have been put in place to implement your project. And also your final grant report, that will be due on January 5th of 2021. And then we have the financial report, which is December 31st. And one thing that we're going to do and implement, and I'm proud to co-chair this opportunity with Dr. Deborah Forholden. And we want to ensure once we have the awardees identified, we will reach out and get information that's relative to this federal funding that Isaiah has spoke about earlier. There's a lot of things that's being dubbed out from a lot of higher ups, if you will. And so it's a great opportunity, but it comes with a lot of red tape when you talk about federal funding. So like I said, our job with federal funding and being in this space is just to make it easier on the applicants. There's so many people in Genesee County and Flint doing such great and amazing work. But we want to ensure that, neighborhood groups, community groups, community and civic groups, nonprofit organizations can all apply, but you have to have that 501c3 designation. We have a great team. Sue Peters and Stephanie Whitledge, our grant administrator, are doing an awesome job of combing through who are eligible to apply. And if you do not have your full 501c3, you can partner with an organization that does to be your fiduciary. The grant opportunity is right on our website. Once again, it's due October 9th at 5 p.m. And you can contact myself, Stephanie Whitledge, my grants administrator, and that contact information is right there.
So everybody can't see, so can you just give out the number too?
Oh, I apologize. Thank you for that equity point, Dr. Deborah. Stephanie Whitledge, she can be contacted at 810-767-3505, and then also her email that is broadly monitored is relieffund@cfgf.org.
So Moses, there is one quick question. If we can back up just a second, when you talked about who can apply, you indicated that there could be partnerships. but to clarify, the organization that would receive the funds on behalf of the organization must be a 501c3. Is that correct?
That is absolutely correct, and that's typically not the funding model of the community foundation, but because these are federal dollars, that is one of those requirements, and I hesitate to say red tape measures, but it is what it is, and our job is to make it as easy as possible for the dollars to go into the community where the work really happens.
Okay. All right. I'm just going to double check here. Anything else? Let's give that number because this is a quick turnaround time. It is these applications are due today by 5 o'clock. And the best thing is, maybe give them a call. Stephanie Wetledge, who is a grants administrator at the Community Foundation of Greater Flint at 810-767-3530. And as he said, you could email the relief fund at cfgf.org. Any other closing thoughts on this process that you want us to consider, Moses?
So far, the applications have been coming in. We've received a lot of questions inquiring about these fundings and these dollars. So an awesome response, as we expected, from Genesee County and Flint. Very innovative work that's happening, and we're looking forward to going through and combing through these and providing dollars to the community where the work truly happens. And so we're appreciative of this platform and this opportunity to be here and to lead in this space. I admonish my leader, Isaiah Oliver, for taking on this task of ensuring that we could get these dollars. And the team with Sue Peters and the whole Community Foundation staff has been awesome to work with, and we look forward to doing more things with the community to make sure that we can overcome during this pandemic period.
All right, thank you so much to Isaiah Oliver, the CEO of the Community Foundation of Greater Flint, and Moses Bingham. Appreciate this information and update. Now, the next individual that we're going to hear from today, I think is becoming a national celebrity, but right here among us, I tease her a lot because she's on flyers now with Dr. Fauci, Dr. Collins from the federal level, and even Reverend Jesse Jackson. So Dr. Deborah Holden, give us an update. You've been telling folks around this nation what we need to do in the midst of this pandemic, and particularly focusing in on how we address the issues of inequity, or what we'd like to think about. We're on the move to make sure that equity is key in these conversations. Dr. Deborah.
Sure, thanks, Yvonne. It's been a really interesting week. Yesterday was Reverend Jackson's 79th birthday, and we had just an amazing day of conversation with Reverend Jackson and many partners from the Rainbow Push Coalition. I did want to share one thing that came out of really got driven home for me out of the last conversation with Dr. Fauci. There's been this big push to get increased African-American and Latinx involvement in the vaccine trials. And I just want to say to people, we do our best every week to make sure we bring people trusted and credible information. And the work is still afoot. It's important now more than ever that people honor prevention. We are a ways off from a vaccine. The myth that we'll have a vaccine by election day, I'm just here to tell you that's not happening. And the best line of protection that we have is prevention. And so I really encourage people to do that. And then the other thing I'll say is, and I've elevated this webinar also to their attention, to see what it looks like when you really do community level dissemination of information, is that we've got to be very vigilant to make sure when a safe vaccine is available for distribution and administration, that vaccine is distributed and administered equitably. So I've pressed all of these leaders, including General Perna, who is the COO, the Chief Operating Officer for Operation Warp Speed, which is the sort of US-based initiative for these vaccine trials and vaccine development, that we want and we demand equity. We don't want to just be in the trials and be represented in the testing. We want to make sure that when a safe, incredible, and a vaccine is approved, that it is equitably distributed and administered. One of the things that they said is that the vaccine would be free. And what they were talking about was the actual medication in the vial, but that it's likely that some places might charge a fee to actually inject it into your arm. And I said, well, then that's not free. If people have to pay a cost, then that's not free. So I've also been working with the National Medical Association, which now has a congressional task force, and they will be working with Operation Warp Speed to specifically make sure that all of these issues are attended to. So I plan on keeping people here up to date and up to speed on what's happening on that national landscape, and make sure that people understand what the opportunities are for activism and chiming in, and also when we'll know that we have a safe vaccine. So in the meantime, I want to give you my regular spiel. Next slide, please. You got to maintain your health and your personal protection, even though the governor's ability to independently issue an executive order that closes down businesses and restricts large gatherings, et cetera, has now been taken away through this Supreme Court ruling that came out last week. It doesn't matter. Those things and those principles, the strides that we've made, and if people have been watching, you'll see that the rates are peaking all across the nation. We've got some states that are all the way back in the red zone. We don't want to go backwards in our progress. So Secretary Gordon, Robert Gordon is the secretary of the Michigan Department of Health and Human Services, has reinforced some of those orders under his powers. And if I had to guess, the same legislature that took action against the governor will likely be coming for Secretary Gordon. And so more important now than ever that you model good behavior, practice good hand hygiene, use your PPE. That mask is the best line of defense, despite what we're seeing from our national leaders. If you have been exposed to somebody, you need to immediately self-quarantine, be tested. The test comes back negative, you need to be retested within another 2 to 3 days to allow time for the virus to incubate and be able to show up on a test. But do recognize that during that time period, if in fact you are a carrier, you can absolutely expose and infect others. To that end, physical and social distancing is super important, keeping at least 6 feet of distance between you and others with your mask on. Continue to do everything you can to boost your immune system, high nutrient diet, regular exercise, good sleep, stress management, clean those high touch surfaces, get tested, take advantage of the testing that we have in our community. And by all means, please continue with your primary and preventive care. And if you have any kind of acute health crises, know that the hospitals are safe for people to come in and get the care that they need. Last thing for me, vote, 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 vote. Check your status, make sure you haven't been purged, plan your vote, vote your plan. I really appreciate the clerk's office and all their good feedback. Vote early and support others in making sure not only that they vote, that they understand there's more than just the presidential election on the ballot, and make sure that people in your life are hip to what's happening, aware of the issues, be willing to talk it through with people. We got to show up in mass if we want to see changes. That's it for me, Yvonne. Thank you.
Thank you, Dr. Deborah. And as we round out today, I would just want to say thank you, my friends. And I'm saying friends, family, colleagues. It's so important that we get this information. It is equally important that we share the information that we receive, because everybody is not able to connect with us during this time. So you making that connection can keep the positive chain of information moving forward. So we want you to know that we have some exercise activities for you. Please continue to get that exercise, be connect with the Greater Flint Health Coalition in their work. CEUs are available for those of you that need CEUs. Community health workers, please do that. Want you to continue to share with others, to like us on Facebook, the Healthy Flint Research Coordinating Center, and subscribe to our YouTube channel. Send us information on our email address as well. Following this broadcast, as we tell you every week, there is a pop-up survey. When you complete that survey about the webinar, you help us to understand what we can do to improve, provide additional information, and make sure we're addressing the issues that are relevant and important to you. We invite you to join us next week on the webinar, October 16th. We'll be right here for webinar number 31. And one more time, visit us at www.hfrcc.org for more details. And appreciation to all of you. And I'll look forward to seeing you again next week.